Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us, as always, is my partner in crime, Dr. Robert Popovian, tuning in from Washington, D.C. He's a pharmacist, economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Connor Mertens from Seattle, Washington, my co-host, and our patient advocate and community outreach manager. Welcome back, Connor. 4th season, episode 1. Let's get started.
That time's just flown by. 4 seasons. Lots of topics were covered throughout our first 3 seasons. So thank you for sticking with us, and we're so eager to get started on this new season with you all. And while we've been away, there's been a few changes in the biopharmaceutical marketplace.
That's right. Lots to talk about. And actually, Connor, as always we do in our podcast, we start off with giving you a percentage. So for this episode, what do you think of the percentage 85% might represent?
85% is usually the odds of the Mariners absolutely devastating me late in the season.
Good guess. And I think that may happen this year. But what we're talking about is a discount. And yesterday we found out that the Humira biosimilar is going to be available on Cusp Plus Pharmacy, the Mark Cuban's pharmacy, for 85% discount of the retail price at about $600 a dose, which is significant savings. But we're going to get into more of this discussion later on our episode.
Well, Robert, let's get after it. I know that we've been away for a while and got a lot of catching up to do. So today we're going to be talking about drug pricing and some shifts in that.
Yeah, exactly, Connor. And since we've been away, some major shifts in the drug pricing paradigm have taken place. And that's what we want to discuss today and what the implications are. What's causing it, number one, but what are the implications of those changes for patients?
So what new news is there regarding the biopharmaceutical marketplace?
So the biggest news was that the 3 insulin producers in this country, Eli Lilly, Novo Nordisk, and Sanofi, have decided to significantly drop the prices of insulin in the U.S. market and cap the price at $35 across the board, which is significant because, the price reduction is almost like about an 80% reduction in price. And really what it does, it kills the net to retail price bubble that is being taken advantage of by the pharmacy benefit management companies, as they are getting a lot of that margin as profit and keeping it as profit. So this is good for patients. This was tremendous amount of news that came out, but there's more, obviously.
Yeah, and you and your colleagues at the Progressive Policy Institute wrote an interesting paper about the shift in the drug pricing paradigm in the U.S. Can you tell us a little bit more about that?
Yeah, so we talk about how the insulin prices were dropped, but there's more to it because we also have an example that happened earlier this year where Johnson & Johnson decided to sell one of their brand products directly to consumers through the Cost Plus Pharmacy, the Mark Cuban's pharmacy, at about a 55 to 60% discount compared to the retail price that's offered through the insurance companies. So again, what we discussed is that there's significant pressure in the marketplace for pharma companies to rethink their pricing methodology, and that's what we want to discuss today.
So I guess the next question is, why did the insulin manufacturers do what they did here?
That's a great question, and that's what we cover in the paper that we wrote with my colleagues Michael Mandel and Aaron Delaney from the Progressive Policy Institute, where we basically deciphered that there are 4 pressure points that are taking place for biopharma companies to really rethink their pricing model. Number 1 is for the insulin specifically. There was a lot of insulin legislation, specific legislation for insulin and diabetics, and also litigation that's taking place both on the state and federal level. And I think that was one pressure point that came about to sort of have these biopharma companies rethink their pricing methodology, and instead of rewarding pharmacy benefit management companies, directly pass the savings to the patients. The number 2 thing is really the Inflation Reduction Act. The Inflation Reduction Act is coming fast and furious, and a lot of pharma companies are thinking about what the implications are for those products that are going to be sort of price set by the CMS. And one of the remedies of those price setting is to drop out of that list, is really to reduce your price significantly and drop out, because the sales are going to be impacted. And CMS then has to reevaluate which drug ends up on that list to set a price. The third issue is a little bit inside baseball, but I believe it's even more of a impetus for pharma companies to rethink their drug pricing methodology, which is the removal of the cap for the average manufacturer price for Medicaid rebates. And, this cap has existed, and the removal, and this is very interesting, the removal of this cap is going to create an environment where biopharma companies are going to have to pay Medicaid to cover their drugs. And, Connor, let that sink in. I mean, not get paid by Medicaid, but actually pay Medicaid to cover their medicines. So the only remedy for that, again, is significantly to reduce your prices. And this impacts a lot of brand products that are older, that have been around for a while, and they've taken massive price increases over time. And the only remedy that I believe exists is for these companies to reduce their prices and not have to be impacted by this AMP cap removal of the rebates. And finally, it's really an external environmental issue, which is the FTC investigation. I think the FTC investigation going on into the practices of the pharmacy benefit management companies is going to give some cover for industry not to really worry about what the implications are if they really change their pricing methodology. And because of the scrutiny that's happening on the PBMs, both on the FTC and also congressional level and on the state level, that pharma companies can be brave and really redo their pricing thought process and help patients out. So those are the 4 points that we believe are going to create an environment that we're going to see significant shift in the pricing methodology of the biopharma companies.
So before this, what role did the PBMs and, state Medicaid programs play in inflating these drug prices? How have the new list prices addressed this issue?
Well, the role that they played really has to do with rebate contracting. And it's not as much the Medicaid programs rather than the rebate contracting methodology, which is favored by the pharmacy benefit management companies. When you have a rebate, which is technically a kickback, the impetus is for the drugs to be higher priced and more kickback going to the pharmacy benefit management companies, which reduces the net price they end up paying the biopharma companies. And this net to retail price bubble has grown significantly into hundreds of billions of dollars. And what has happened over time is that every time a biopharma company sells a brand name drug, on average, 50 cents or 50% of it goes back to the supply chain, whether it's the pharmacy benefit management company and the insurer primarily, but also the wholesaler, the pharmacies, the providers, the physicians, the hospitals, and so on. And what the pharmacy benefit management companies have thought about is that why are we doing this rebate contracting or protecting this rebate contracting model, which we get only 50% of the benefit, but we get the 100% of the blowback politically because of these high prices. So the rebate contracting model has really driven these higher price models to be favored by the pharmacy benefit management companies. And what people don't understand is that when you have higher prices and higher kickbacks, even if the PBM passes on a significant percentage of it, let's say back to the employer or whoever the plan sponsor, they still benefit more from having that methodology because they keep a percentage of it and of the rebates and also a significant portion, if not all of the fees and everything else that they charge. So that's what's driven this whole premise of higher prices in the marketplace. And what the insulin manufacturers did by dropping their price, they really exposed this environment where higher list prices were only benefiting one entity and one entity only, which was the pharmacy benefit management companies.
So are there other examples of how drug pricing is evolving here in the US? Can you give us any other examples aside from our insulin discussion?
Yeah, absolutely. I mean, I mentioned that Johnson & Johnson decided to sell one of its brand products directly to consumers through the cost plus pharmacy model, which is the Mark Cuban's model that sells cash-based pharmaceuticals directly to the patients. And they've discounted that drug by about 60%. And that's significant. But there was even more significant news yesterday, and we can talk about that with regards to what happened with the Humira biosimilars.
Let's dive into that more. Biosimilars are starting to be introduced into the U.S. marketplace. What did we hear yesterday?
Right. So the retail biosimilar market is increasingly evolving, and it's going to evolve even significantly more this year. Humira, the largest selling biopharmaceutical in the US, with sales of upwards of $20 billion annually, is going to get significant competition in the marketplace through these biosimilars. And the first biosimilar was introduced by Amgen in the market and has gotten very little traction because, again, it's been priced lower than the Humira, and as we discussed, PBMs prefer the higher price, higher rebated products. But what happened yesterday is another biopharma company that is developing a Humira biosimilar, Coherus, decided to sell its biosimilars directly through Cost Plus Pharmacy at 85% discount. So in effect, they set up a ceiling for the price of this biosimilar now, and there's no floor, because the interesting part is going to be how this drives other companies to reprice their biosimilars, and including AbbVie to reprice their Humira. Interesting part about this whole issue is that how the pharmacy benefit management companies and PCMA, which is the trade organization for the PBMs, is going to try to spin the whole thing about why they're covering the higher price alternative compared to the lower price, now that we know at 85% discount, Coherus product. This is going to be fascinating information coming out in the next 2 to 3 weeks to see how they respond with spinning, and their PR departments are probably spinning this thing like crazy, trying to come up with reasons why they're covering the more expensive medicine.
Well, I guess that leads me to kind of my next question, which is who stands to benefit and lose from these changes? Like, how are patients expected to benefit from these reforms, and what impact will it have on the PBMs and others who, are going to benefit from a high list price and the rebate?
The biggest losers from lower list prices are the pharmacy benefit management companies, without a doubt. I don't care anybody who wants to say otherwise. They are the biggest losers because they're no longer going to be able to collect those humongous rebates that they were doing, right? Because now that the list prices dropped significantly, the rebates are going to go away, or they're going to be significantly lower. The biggest winners are the patients. We've discussed this issue on numerous occasions on our podcast. When a patient shows up to a pharmacy counter, and if they have a deductible or a coinsurance, their deductible or coinsurance is based on the inflated retail price that they end up paying, not the net price that's been negotiated on their behalf by the PBM. So what's going to happen with these lower prices now is when a patient shows up to the retail pharmacy at the counter and they have a coinsurance or deductible, they're going to be paying it based on these lower retail prices that have been introduced, whether it's through the insulin manufacturers or these biosimilars. And that's going to be leading to tremendous amount of savings for patients. This is significant. Patients and patients only are going to benefit from this. And one of the things that we need to do is encourage our patient population, our listeners, to go in and even ask for more companies to be brave and really rethink their pricing methodology and reduce their prices so they can benefit. And this is tremendous news for patients.
All right, Robert, we've been doing this for 4 seasons, so I'm going to make sure you get the last word in here. But, I think that this is a really exciting thing for patients. The shift that we've seen with the insulin has exposed the dirty, dark secrets of the drug pricing industry. Ultimately, this new paradigm is the unintended but welcome result of lots of legislative and regulatory and market pressures that have been exerted on the biopharmaceutical industry from patient advocates and folks that are just trying to get patients easier access to medications. But as always, let's make sure you get the last word, Robert. What do you think?
No, I agree with you, Connor. I think making things uncomfortable for the players in the marketplace to the benefit of patients is what we strive for. And if PBMs are losing money and losing profits, that's not a bad thing for patients. Trust me. At the end of the day, the only person that is going to be the biggest loser is the pharmacy benefit management company, because they're going to make less money and less profits. The biggest winners are the patients, because they're going to show up to the pharmacy counter and pay less for their medicines. And that's what we want in the marketplace. Enough with the distortions, enough with the gamesmanship. Patients need to benefit. And this is unbelievable news. And I'm so happy that Eli Lilly, Novo Nordisk, Sanofi, Coherus, J&J, all these companies that are producing biosimilars that are brave enough to rethink the pricing paradigm. Started with insulins, we're getting into the autoimmune disorder drugs. This is great news for patients. Let's continue doing this. Let's put the pressure on the system to the benefit of patients. And we're going to get 2 things out of this. 1, less profits for PBMs and more money in the pockets of the patients.
Thanks for breaking that down for us, Robert. I know that there's some really valuable information in there for our listeners, and like you said, this is an important topic that folks should be up to date on and should know what they're talking about. Speaking of information, we are on our 4th season of Healthcare Matters, and I hope that you take your chance to go back and listen to the first 3 seasons. A lot of valuable information in there. So don't forget to subscribe to our podcast on Apple, Spotify, or wherever you might be listening so you never miss an episode. If you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your friends and family. It'll help more people like you find us.
So we're starting season 4. If you have any questions, thoughts, suggestions, ideas, you can send it our way. Please email us at podcasts@ghlf.org. And if it's an interesting topic and it's an interesting question, you may be featured on our upcoming episodes. We're trying to be much more user-friendly, as they say, this season. And we're going to include a lot more external guests. In fact, we are planning on having Ben has already arranged, our producer, to bring on our Corey and JP and Connor to talk about their tour of the states and what has happened in the first half of the year in the state legislative efforts. So stay tuned.
That's right. I'm really excited to cover our state advocacy efforts in our next episode. And lastly, before you go, make sure to listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of those podcasts at ghlf.org/listen. As always, he's Dr. Robert Popovian.
And he's my partner in crime, Connor Mertens. And welcome back, Ben. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.